Welcome to the deep dive. Today, we're looking into something really important for the very youngest pets, puppies, and kittens. It's called Ophthalmia Neonatorum. And basically, it affects them before their eyes even open. Quite serious, potentially.
It really is. Yeah, we've got quite a bit of information on this, looking at what it is, the causes, the signs, and crucially, how it's treated.
Right.
We want you, the listener, to really understand this condition because it can actually threaten their sight.
Okay, let's get into it then. Ophthalmia Neonatorum. It sounds complex. What exactly are we talking about here?
Well, in simple terms, it's an infection. It affects the conjunctiva, that's the lining inside the eyelids and covering the white part of the eye.
Okay.
And sometimes it also involves the cornea, the clear front part. The key thing is the timing. It happens either before or just as the eyelids are naturally starting to separate in these newborns.
So we're talking really young animals, tiny.
Extremely young, yes.
What kind of infections? Are there specific germs or viruses involved?
Yeah, there are. For both puppies and kittens, common bacteria like Staphylococcus and Streptococcus are often involved. Fairly common bacteria.
Right.
But specifically in kittens, feline herpes virus is a very significant cause as well.
Herpes virus.
And it's worrying how these infections, even common ones, can potentially cause serious vision problems in eyes that are still developing.
Absolutely. So how do they even get infected so early? Where does it come from?
Good question. There are a few routes. One is actually in utero, so infection while they're still inside the mother.
Oh, wow.
Another way is during birth. If the mother, the dam, has a vaginal infection, the newborns can pick it up as they pass through the birth canal.
Makes sense.
And then there's the environment. If the area where the newborns are kept isn't clean, isn't hygienic, that's another potential source.
So the mother's health and the cleanliness of the whumping box, basically.
Exactly. It really highlights how vital those factors are right from the start.
Are certain breeds more likely to get this, or is it across the board?
Our sources suggest it really affects all breeds. Cats, dogs. It doesn't seem to discriminate based on breed.
Okay.
Main thing is that very specific age window before the eyelids open, which is usually between 10 and 14 days old.
Got it. So 10 to 14 days. What should people, breeders or new owners be looking out for? What are the warning signs?
This is really key for catching it early. One of the most noticeable signs is that the eyelids, which are still fused shut at this point, that's called physiologic and callable pharynx.
Right, fused shut.
They start to bulge outwards.
Bulge. Why do they bulge?
Well, it's because discharge, like pus and other debris, is building up behind the closed lids. It gets trapped in the conjunctival sac.
Ah, I see. So there's pressure building up.
Exactly. You might even see some discharge, maybe mucousy or even thick, yellowish-greenish pus, what we call mucopurulent discharge, may be seeping out from a tiny opening near the inner corner of the eye.
Okay, so bulging and maybe some seepage. That doesn't sound good.
No.
Yeah.
And it can get worse. We can see ulceration, actual sores forming on the cornea or the conjunctiva.
Oh, that must be painful.
It certainly looks very uncomfortable. And then you can get adhesions called symbolphoron. That's where the inflamed conjunctiva starts sticking to other parts of the eye, like the cornea or even the third eyelid.
Sticking together.
Yeah, and in thankfully rare but very severe cases, the cornea itself can actually rupture, perforate.
Oh, no.
And then the iris, the colored part, can bulge out. That's a prolapse. And if that happens, it can lead to the whole eyeball basically collapsing and shrinking.
That's devastating. Okay, so bulging lids, any discharge, definitely signs to act on immediately.
Absolutely.
You mentioned the causes earlier, the mother's infections, the environment. Are those the main risk factors then?
Pretty much, yes.
Yeah.
Those causes are the main risks. So an infection in the mother around the time of birth, particularly a vaginal one, is a big risk factor.
Right.
And likewise, an unclean environment just gives bacteria more opportunity to cause trouble. Keeping things clean is a huge preventative step.
Okay, so if someone sees those signs, suspects this condition, how does a vet figure out for sure that it's Ophthalmia Neonatorum?
Diagnosis usually starts with a careful physical exam. The vet will look closely at the newborn's eyes and often check the mother too.
Checking both, okay.
Yeah. And a really useful tool is fluorescein stain. It's a special orange dye. When you put a drop in the eye and look with a specific light, any ulcers or scratches on the cornea just light up. They glow green.
Oh, neat. So it highlights any damage.
Exactly. Makes it very clear if there's ulceration.
Could it be anything else? Anything that looks similar?
Yes, there are what we call differential diagnoses. One thing to consider, especially if the animal's a bit older, say older than that 10, 14-day window and the eyelids are open, is entropion.
Entropion, what's that?
That's where the eyelid rolls inward, so the eyelashes rub against the eye. It can also cause discharge.
Ah, okay.
But the key differences are usually the age entropion tends to show up a bit later and the fact that the eyelids are already open. With Ophthalmia Neonatorum, the problem starts behind those fused lids.
Got it. Age is a big clue then. What about lab tests? Do they help?
They can, yes. Taking a swab of the discharge from the eye, or maybe even a sample from the mother's vagina, and sending it for culture, that can tell us exactly which bacteria are involved.
Ah, to guide the antibiotics.
Precisely. And psychology, looking at the cells under a microscope, can also give clues. For cats, there are specific tests, like PCR or immunofluorescence, to check for that feline herpes virus we mentioned.
Okay, so targeted tests.
Right. Usually general blood work isn't needed unless the puppy or kitten seems sick overall, systemically unwell.
Understood. So the focus is really on the eye itself. Now, the big question, how do you treat this? What's the process?
The absolute number one most important step is to gently separate those fused eyelids.
Gently being the key word, I imagine.
Absolutely crucial. It's usually done by applying very gentle outward traction, often starting near the inner corner, the medial canthus. Or a vet might use a very blunt instrument like a closed hemostat, or even the blunt back edge of a scalpel blade slipped into any small existing gap to gently prise the lids apart.
Not cutting, just separating.
Exactly. Separating, not cutting. It has to be done with extreme care.
Okay, so the lids are open. Then what?
Then you need to clean everything out. Flush the conjunctival sac and the cornea thoroughly with warm, sterile saline solution, or sometimes a very dilute povidone iodine wash. Get rid of all that built-up discharge.
Flushing it clean.
Yes. And warm compresses applied gently can also help. They can aid the initial separation and also help prevent the lids from sticking shut again afterwards.
Makes sense.
And of course, if the little one is weak or dehydrated, they might need supportive care too, like fluids or help with feeding.
Right, treating the whole patient. So what about medications? You mentioned antibiotics earlier.
Yes, topical antibiotics are the mainstay. Usually a broad-spectrum ointment or drops, like a combination of neomycin, bacitracin, and polymyxin B, often called triple antibiotic.
Okay.
And you apply it frequently, usually something like 4 times a day for at least a week.
4 times a day, okay.
Though if those culture results come back showing a specific bacteria is resistant to that, the vet might switch to something more targeted.
Right. And for the cats with herpes virus?
Then specific topical antiviral medications would be added to the treatment plan.
Okay. Are there any medications you shouldn't use?
Yes, definitely. Tetracycline antibiotics, whether topical or oral, should be avoided in these very young animals because they can affect bone growth and stain developing teeth.
Good to know.
And very importantly, topical steroids, corticosteroids, are contraindicated. They should not be used here as they can worsen infections, especially viral ones, and delay healing or even worsen ulcers.
No steroids. Got it.
And just as a side note, though it wasn't the main focus of our sources here, if an infection like Chlamydophila was suspected or confirmed, different antibiotics like afloxacin or ciprofloxacin would likely be chosen.
Okay, so specific choices are important. What happens after the initial treatment? What's the aftercare like?
Aftercare involves keeping up with those warm compresses for a few days, just gently wiping the eyelids to stop them from sticking back together,
Okay.
continuing the topical antibiotics for the full course, usually at least 7 days, even if those better sooner.
Right, finish the course.
Absolutely. And it's really important to keep a close eye on the other puppies or kittens in the litter, just in case they start showing signs.
Check the siblings, yeah.
And as we mentioned, if the mother was found to have an infection, like a vaginal infection, that needs to be treated too to stop the cycle.
Makes sense. Treat the source. So, can this whole thing be prevented? How can people minimize the risk?
Yes, prevention is definitely possible and much better than cure, obviously.
Yeah.
The biggest things are hygiene, keeping the whelping or queening area really clean, making sure the mother is clean, especially around her nipples before the newborn's nurse.
Basic hygiene, okay.
And if possible, addressing any known infections in the mother before she gives birth. Pre-breeding checkup or checking her health during pregnancy can sometimes identify issues that can be treated beforehand.
Proactive care for the mother.
Exactly.
What happens if, despite best efforts, it occurs and maybe isn't caught right away? What are the potential long-term problems if it's left untreated?
Well, the complications can be quite severe, unfortunately. Untreated, it can lead to severe keratitis. That's the corneal inflammation, which can cause permanent scarring.
Scarring on the cornea, that affects vision.
Absolutely. Significant scarring can impair vision. And those adhesions, the symbol for on, where things stick together, can also cause ongoing problems and potentially affect vision or eyelid movement. And in the worst case scenario, as we touched on, if the cornea ruptures, it can lead to the eye shrinking, phthisis bulbi, and, well, permanent blindness in that eye.
Gosh, that really underscores the need for quick action.
It really does.
So, assuming it is caught early and treated properly, what's the usual outcome? What's the prognosis?
Thankfully, if it's diagnosed promptly and treated correctly, and if none of those severe complications like corneal rupture have happened, the prognosis is generally very good.
Oh, that's encouraging.
Yes. Most puppies and kittens recover well with timely treatment, and their vision can be saved. Early intervention is really the key.
Okay, great. So, let's just quickly recap the main points from our deep dive today. Ophthalmia neonatorum. It's a serious eye infection in newborn puppies and kittens happening before their eyes naturally open.
Right. Caused mainly by bacteria, sometimes feline herpes virus in cats.
And the key signs are those bulging, fused eyelids, maybe some discharge. It can lead to ulcers, adhesions, and potentially blindness if not treated.
Diagnosis involves a vet exam, maybe fluorescein stain, and sometimes cultures or specific virus tests.
Treatment hinges on gently separating the lids, cleaning the eye thoroughly, and using the right topical medications, antibiotics, maybe antivirals.
And definitely no tetracyclines or steroids in these little ones.
Right. Prevention focuses on hygiene and the mother's health. And the good news is, with prompt, correct treatment, the outcome is usually positive.
Exactly. That sums it up well. And maybe a final thought for everyone listening.
Yeah.
Just think about how completely reliant these tiny newborns are on us, especially in those first couple of weeks. Simple things like ensuring a clean environment and being aware of the mother's health can make such a huge difference to their future, especially their sight.
That's a great point.
So keep a really close watch on any newborn litters, and if you see anything like those bulging eyelids or discharge, don't wait. Get veterinary advice straight away. It could save their vision.